Hi everyone, I'm Molly and I'm a registered dietitian, and I just want to thank everyone for coming to our session today. Okay, so as Charmaine talked about, the pancreas is extremely important for digestion. And the thing that I like to talk most about is the function, but also how it relates to proper nutrition and going into surgery in a good nutrition status, but also recovering from the surgery. And so the pancreas produces enzymes, which we call juices, or vice versa, and those are responsible for the breaking down of your protein, your fats, and your carbohydrates. And the absorption, to allow your body to absorb that nutrition that you can maintain. And also, it helps digestion by making hormones. And these are chemical messengers that travel through your blood. They regulate your blood sugars and your appetite, and they stimulate stomach acids, and they also signal your stomach on when to empty. And so when we have something going on with, when you have something going on with the pancreas, in this case, pancreas disease, but pancreas cancer, that function of creating those enzymes or getting the enzymes where they need to be activated, which is the small bowel, that process can be interrupted. And so we see symptoms like gas, bloating, early fullness. Some patients will say, Molly, I feel full up to my collarbones, or they feel full after eating just a couple of bites of food, which is abnormal. New or increased reflux. And then more extreme cases, some would experience pale or fatty looking, like oily looking diarrhea, and then also have weight loss. And so if someone's experiencing these, my first thought is, does this person need replacement therapy? It's a medication. We could talk about that in depth later. So the enzymes that are important for digestion are lipase. This is the enzyme that breaks down the fat in your diet. And without this enzyme, your body has trouble absorbing the fat, and then also your fat-soluble vitamins, vitamin A, vitamin D, vitamin E, and vitamin K, ADDIC. And if your body's not producing enough of this enzyme, or it's not activating where it should be, then it can lead to that fatty, oily looking diarrhea. Protease is the enzyme that breaks down the protein in your diet. And this enzyme protects you from certain bacteria and yeast that can live in your intestines. And also, not having enough of this enzyme can lead to undigested proteins, which can cause allergic reactions. And also, talking about proteins, if we're not absorbing the protein, then how are we to make sure that our wounds are healing, our muscles are getting good nutrition and strength? And so making sure that we're digesting and absorbing every piece of the food and drink that we're consuming is extremely important. And then amylase, my head might be in the way of that, but amylase, that breaks down the starches into sugar. So carbohydrates go into sugar, and that's what we use. Our body uses that for energy. So not having enough of this enzyme can lead to diarrhea from undigested carbohydrates. And I'm going to kind of jump around on this slide, but when we're talking about, again, pancreas disease and going into surgery to heal that, I always want to identify early the risk of malnutrition, or if someone truly is malnourished going into surgery. Because as we know, 80% of pancreatic cancer patients develop malnutrition. Now, this can happen at diagnosis, through treatment. This can happen going into surgery, because of the surgery, because it's a big one, and then, months later. And so making sure that we're identifying malnutrition, we're minimizing the risk, and we're just addressing it as early as we can will only help the recovery of the surgery. And when we're talking about the pancreas and the function and enzymes and all of the malabsorption, that's important that we identify that your pancreas is doing the job that it needs to do in order to absorb your nutrition, and so that you're not becoming malnourished. Because we know that malnutrition leads to skeletal muscle wasting, fat loss, longer hospital stay, increased risk for complications, decrease in wound healing, reduced response to treatment, those go hand in hand, and overall reduced quality of life. And so what your dietitian team will do, again, is to do a nutrition assessment and making sure that you have good nutrition going into the surgery. Excuse me. So we know that good nutrition helps you maintain that muscle mass. It improves your immune function and improves your GI function, which can lead to a faster recovery after surgery. So some of these side effects can happen before some of these side effects can happen before surgery, during treatment, but a lot of these do happen after surgery. Your care team can help with solutions to these side effects. So when patients come to me and they're having a poor appetite, I ask that they do small but frequent meals. They schedule their meals and snacks throughout the day, whether it's on their phone or they print out a schedule that they can put on the walls just to be reminded, right? They're not having those hunger cues anymore, so just a reminder to eat kind of throughout the day. Having liquid calories, sometimes it's easier to drink something when you're not feeling hungry, right? Chewing can become or feel like a chore. So doing something like a smoothie, a milkshake, a protein shake, etc. Light activity like walking or resistance training can build up an appetite, and it can help with sleep, which can help with appetite. And then, of course, appetite stimulant. Early satiety, so that's that early fullness. I always think about, does this person have EPI, which is the exocrine pancreatic insufficiency that we talked about earlier with the enzymes. But if I say no, or if I think no, then I do recommend that people alleviate the gas and the bloating foods that can cause that. And so high fiber and high fat we would ask to stay away from. Consuming liquids between your meals, waiting about 30 minutes before and after a meal to drink a cup of whatever liquid of your choice, just so that your stomach doesn't fill up on a liquid, it gets that good nutrition from that whole food. Small servings, but more often. And the medications we do offer to help with the motility of the GI tract. If someone's experiencing nausea or vomiting, we ask that you eliminate the best you can the offending odors, so ones that have a strong smell, especially while cooking. If someone's making you a meal, then maybe going outside or sitting in a different room. Dry crackers and toast with peanut butter, that way you're getting some good protein. Try to avoid greasy, fried, spicy, or too sweet of foods. Consuming room temperature or cold foods can help kind of settle the stomach. Increasing your oral care before your meal, that can help with some of the nausea as well. Sipping liquids throughout the day, making sure you're staying hydrated. People who don't drink enough fluids can then often become nauseous, especially after surgery. And then, of course, we do offer an anti-emetic, which is a medication that will help with nausea. Okay. Taste changes. So if you experience taste changes, there's many kinds of this, but rinsing your mouth prior to eating with a solution. Metallic taste, if you use a regular silverware and you taste more metallic tasting, then we ask that you use plastic utensils and that you would not eat food out of a can. Using tart flavors to enhance dull taste, and then trying new foods often. Taste changes every day, and so trying not to eliminate your favorite foods because they might taste good again. And then those who have a zinc deficiency sometimes will offer or recommend that people take a zinc supplement for 2 to 3 weeks, in the event that that has something to do with their taste change. If someone has diarrhea, we ask that they limit and avoid insoluble fiber, simple sugars, and then also sugar alcohols or sugar like sweeteners. That can induce diarrhea. This can also be treatment induced, before surgery or after surgery. Bacterial overgrowth, lactose intolerance. If you're getting a Whipple surgery, this can be something that's temporary or a little bit more long term, and it might be new for you. So your dietitian team will help guide you through that, what lactose intolerance means for you. Exocrine pancreatic insufficiency, so that EPI component that we talked about earlier. And then dumping syndrome, which is not as common, but in the big Whipple surgery, it can happen, and that can cause diarrhea. Okay, I'm moving myself around here. Okay, so just overall tips and tricks. Frequent but small meals. So every couple of hours, you're putting something into your mouth, whether it be drink or a few bites of food. All of that adds up. If you separate and eat even a little bit of protein at every single meal or snack or bite, then at the end of the day, in theory, we should be able to meet a good portion of your protein and calorie and hydration needs. Separating your foods and beverages so you're not filling up on liquid or not calorically dense food, or liquids, excuse me. Keeping a food journal. I love this one because it not only helps your care team to help you really, in regards to, am I eating enough? Do I have any intolerance? But I also think it helps the patient, the person, but then also family too, and just to be more aware of the things that you are putting, into your mouth, and how we can better help you through that process. Eating when you feel hungry, even if it doesn't feel like a mealtime. If you wake up in the middle of the night and you feel hungry, we ask that you eat. Placing bowls of snacks around the house, so nuts, fruit, packaged snacks. That way you're increasing your snacking. It's a small meal, right, or a small snack, and that way you're not skipping any nutrition throughout the day. If you have a fat intolerance, eating healthy and unsaturated fats are better tolerable, like avocados, olive oil, nuts, and nut butters. Okay, here I go again. Okay, oral nutrition supplement. So this is let's see here. We always recommend before surgery that people drink of their choice a high calorie, high protein nutrition supplement. Now, if you're not eating well, I do recommend that people aim for 250 or 300 calories, and just looking on that label to make sure that you're getting enough calories, and then also at least 20 grams of protein per supplement. And so if you're diabetic and you're not eating well, I do still suggest that you're doing a higher calorie, high protein supplement. And once you get back to eating well, then we can talk about switching you to a diabetic friendly formula so that we can manage your blood sugars a little bit better. Glucerna would be an example of that. And so after surgery, it's easier to tolerate and digest liquid calories. So we really do depend on these nutrition supplements. Now in the hospital, here at Piedmont Atlanta Hospital, we do hold Kate Farms and we hold Ensure Complete. So these are ones that we would offer you, and you would have a variety of flavors, but you're also open to bringing in your own flavor or brand that you want into the hospital as well. Okay, so like Charmaine mentioned, that some people do go into surgery malnourished, and if we do think that's happening, then we'll talk to you about a feeding tube so that we can help you with good nutrition after surgery, because we think that you need, one, an extra boost, right? Some extra nutrition help, but then also we might assume that you won't be able to eat or tolerate food, normally for a while, and that's okay too. So we want to make sure that you and your family feel prepared and we would talk to you most likely about a feeding tube that goes straight into your stomach well before the surgery happens. Now, there is another kind of feeding tube, and it goes in your nose during surgery. It's yellow, and that is removed before you leave the hospital. And so those are the two kinds of feeding tubes that we would recommend if at all needed. High blood sugars are very common in the hospital. It's our body's natural reaction to stress. So you might find yourself on insulin while in the hospital. If that's new for you, please do not worry. Most of the time, our patients do not leave the hospital on a new insulin regimen. But if that's the case, then we, of course, will talk to you about that. Now, over here to the right, this is our typical diet advancement. The first couple of days, I say, are made for movement and pain tolerance, or pain management. And then you'll slowly, each day, get a tray of food, liquids being the first tray, and then it progresses after there. Most of our patients discharge on a regular diet, which, some restrictions, low fiber, low roughage. And my biggest advice is do not eat or drink anything fast. Those trays are meant to test your stomach for any intolerances. It's not necessarily meant to nourish you at that time. You will be uncomfortable, and I just don't want anyone to be then fearful of the food that they're eating. So, okay, I think that's it for me. I appreciate you guys. Bye.